Well, sometimes I have to wonder, is there anything about multiple sclerosis that isn't controversial? Well, hello everyone, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with multiple sclerosis for 38 years. And one of the great joys that I have is researching information about this interesting, mysterious ailment and posting videos so that I can share what I've learned with you. And I have to say, I was really taken with this one that I just saw. It was published about 3 months ago, but I just saw it yesterday. It's by Dr. Brandon Beaber, MD, who is a neurologist that I follow on YouTube. I've been following his videos for quite some time. He's always got interesting things to say. I like this one in particular, maybe because it is sort of a compilation almost of what's going on in the field of MS right now. The title of the video is 10 Controversies in Multiple Sclerosis. Here's the list of what he says are the top 10 controversies. Escalation versus induction therapy, hematopoietic stem cell transplant, chronic cerebrospinal venous insufficiency, the cost of MS drugs, and what he calls Me Too drugs, nutrition and MS, environmental causes of MS, the cause of progression in MS, the role of Epstein-Barr virus, and finally, age and disease-modifying therapies. And all of those are indeed controversial. Let's hear some of what he has to say as we consider each one of these controversies in turn. Obviously, I'm not going to play the whole video, but I do recommend that you look at it, so I'll link to it down below. But I'm also going to link to videos that I have made over the last couple of years that touch on these same subjects. Okay, number 1 on his list is escalation versus induction therapy. And basically what this is the decision whether when someone presents with an MS symptom, even maybe before they've been officially diagnosed with MS, so maybe they have optic neuritis or something else, the doctor is not quite sure yet what the course is going to be, but they have a choice there. They can either go with what they call escalation therapy, which is to start you out on something pretty low key, non-aggressive. If you do well on that, fine. If you don't, they might move you to something that's more aggressive in treating your MS. The other option would be, of course, the induction version, where they start you right off the bat with something that is aggressive, like Ocrevus or one of the other monoclonal antibody treatments, because those do tend to show, at least in many studies, to be highly effective. Now, this is a controversial position because some doctors feel that, well, we should really use the medicine that is no more aggressive than the person really needs to have. So if you do really well on something like Copaxone, then why should I move you to Ocrevus or something else that's more aggressive and, as Dr. Beaber points out, carries more side effects and more dangers, basically. So why would we want to do that? I first heard about this from Dr. Gavin Giovannoni, and of course I talk about him a lot. He is very much in the camp of starting people out on a very effective, aggressive therapy, no matter what they present with, because he feels so much of the damage that's happening with multiple sclerosis is not happening in a way that shows up on your average MRI or your physical exam. There's stuff that he calls smoldering MS that's going on at the cellular level, and he feels like the more aggressive therapies are more likely to get at some of that. Not that they're perfect, but they're certainly moving in that direction. I have not been able to find a video that I made specifically on this topic, but I know that throughout my videos, when I've talked about Dr. Giovannoni I have mentioned his belief that we should start out with very aggressive therapies as soon as possible, because he feels like we just lose ground if we don't. By the time we decide we need to move on, it may already be too late in some ways. Damage may already have happened that's not reversible, or at least not easily reversible. I don't know how I feel about that. I guess in my stage of multiple sclerosis, it's way too late for induction therapy. I don't even know whether getting on any MS medication is all that useful for me at this point. If I were in my 20s and I had my first symptoms, I would be interested to see if the neurologist that I talked to recommended aggressive therapy or wanted me to kind of take more of a let's just start slow and wait and see. I'm really curious what you all think about that, because that is very controversial, and it is very justifiable that Dr. Beaber put that as his number one controversy in multiple sclerosis. Number 2 is hematopoietic stem cell transplant. Now this one truly is controversial. I've never made a video about this, so I will just let Dr. Beaber explain the pros and cons. It's definitely not something I've ever considered myself, and I'd be interested if you ever have.
I previously did an analysis of different head-to-head trials, link in the description below, and I ranked HSCT as likely the most effective treatment in MS, so why not just go for it right away, or at least consider it early in the course of the disease when it's most effective. Although it's not a stem cell treatment per se, it's really the chemotherapy drugs and the conditioning regimen that wipe out the immune system and drive the therapeutic effect, but it can be incredibly effective, sometimes inducing long-term, even indefinite remission, and you may not need to take future therapies. Of course, there is a catch, which is the side effect of the drugs. A lot of these drugs can significantly weaken the immune system and cause infections, and also cause other side effects, such as infertility, depending on the unique conditioning regimen.
I'm looking at this graph that he had earlier, and I can see that I was on Copaxone number 7. Not one of the more effective ones, according to him. But I think I've done pretty well. I don't know, maybe if I were in my 20s I'd feel differently, but given my 38 years and knowing how I've done, I guess I'm kind of okay with not having gone with this. The side effects sound like they're really kind of risky. So maybe I'm a scaredy cat, but I don't want to do that. Number 3 is chronic cerebrospinal venous insufficiency. I never made a video about this either, but I do have some experience with it. So after I let him explain it, I'll tell you more about that.
In 2008, an Italian vascular surgeon, Dr. Paolo Zamboni, proposed a new hypothesis for the pathogenesis of MS, that it wasn't caused by an abnormal immune system, but rather abnormal veins in the head and neck, causing congestion and increased pressure in the veins. And maybe immune infiltration into the brain and spine was a secondary phenomenon. He did a famous study showing a very strong correlation between the presence of venous abnormalities in the head and neck and multiple sclerosis. And many people were having interventions, so-called liberation therapies, angioplasties, to open up veins, and stenting procedures. The treatment is widely regarded to be unproven, but even today there are some steadfast proponents.
Back in the late 2000s, I was living in upstate New York when this research hit the MS community and took us kind of by surprise, and we were pretty excited about it. So a friend and I went to Albany, where they were doing a clinic, to check us out to see if we had problems with our veins. And I did go through the imaging part of the process, but somehow I just didn't feel like going on any further. It didn't feel right to me, so I just didn't, and I'm not sorry. High cost of MS drugs. Oh, we've all experienced that. I haven't really made a video specifically about it, but I've mentioned it many times. Let's see what Dr. Beaber has to say about it. The graphs are pretty interesting.
These disease-modifying therapies are ridiculously expensive. Take a look at this graph of the cost of different DMTs over the last several decades. You can see as more and more drugs are coming onto the market with more competition, the price is actually going up. That's strange. This so-called shadow pricing, copying the price of other drug companies, greatly outpacing the rate of inflation, is completely legal and common practice. It's particularly bad in the United States. Take a look at a single dose of Avonex, the price in different countries, the United States and other countries. This is perhaps one of the least effective disease-modifying therapies. And it doesn't just affect insurance companies because they fight back as well and introduce co-pays so people with MS can't afford their drugs.
I was first diagnosed with relapsing remitting MS, and then I was on Copaxone until they diagnosed me with secondary progressive, and then the insurance company said that there was no study that showed that that was effective, so that was that. That's another way the insurance companies get out of paying the high cost of those MS drugs. This next one I hadn't realized, but he had some very interesting things to say about how different formulations or different brand names of the same drug essentially cost way differently.
Me Too drugs. You'd think at the cost of these disease-modifying therapies, we'd be getting new, innovative drugs that have never been seen before. That is true sometimes. For instance, Tysabri was truly a new, unique, and innovative drug. But many of these new drugs are essentially copies of older drugs that have been used in MS and other autoimmune diseases. Take a look at Aubagio and Arava, the enormous, greater than $100,000 per year cost of the drug, and they have the exact same active ingredient. Think about a 20-year-old taking this drug for 40 years until age 60. That's a $4 million difference. What exactly are we getting for that $4 million?
What indeed? Examples like he gives here just really make me wonder why it is the MS community is being so exploited. It's not like most of us have that kind of money, and it's not fair to expect the insurance companies and all their patrons to pay for all that. Now, in this next topic, nutrition, I have made several videos, and I'll link those down below. But Dr. Beaber is right to be somewhat skeptical because not all of these diets can be equally effective, really. I think he's right that we don't have any firm conclusions yet. Nonetheless, I think nutrition is of paramount importance to MS.
Is there a best diet for MS? There are various proponents of different diets which contradict each other. For instance, Dr. Roy Swank believed in a low-saturated fat diet. Dr. Terry Walls believes in a modified paleo diet. In the Best Bet diet, promoted by Dr. Ashton Embry, there's sort of a combination of those two types of diets. And in the book Overcoming Multiple Sclerosis, they recommend a whole foods plant-based diet plus seafood. Who's right? There are tons of anecdotes supporting all of these diets. There are some observational studies that could point us in a certain direction and a few small randomized trials, but nothing really definitive. But there are some new ongoing randomized trials that could give us some more information.
Well, just because I think nutrition is so important, I'm referring you to a video that I made that you can see here, where I really just look at sites like Mayo Clinic, the MS Society, Healthline, others, just to see if there's some commonalities of the kinds of things they tell us we should eat and shouldn't eat when we have MS. So go ahead and check that out and see if that's helpful at all to you. I hope it is. Now, I did make a video on this one, and I will link it below.
Number 7, what about other environmental factors? If you look at this map of the prevalence of MS throughout the world, you'll see that the prevalence varies tremendously. For example, in Cuenca, Ecuador, the risk is only 1 in 25,000, but in Syracuse, New York, it's 1 in 222, a more than 100-fold difference. Something must be making MS more common. But what is it? Is it nutrition? Is it that we're too clean, we don't get exposed to parasites when we're young, and that changes the development of the immune system? Do we not get enough sunlight exposure? Are we too stressed out? Is there a difference in diagnostic criteria? Do we just have more MRI machines, or are there other toxins or other aspects of modern society? No one exactly knows for sure, but something must be making it more common. Number 8, the cause of progressive multiple sclerosis.
Okay, in this section, Dr. Beaber gives several theories, but I'm only going to cover the one. He's going to talk about smoldering MS and give a good definition of what that is. Again, I've first heard about that from Dr. Gavin Giovannoni, and I was very taken with that theory. It sounds really plausible to me, so that's what I'm going with, even though I suppose I could be wrong.
Some people, as they get older with MS, are very stable, but others have a slow, insidious, progressive worsening of symptoms, and to their frustration, their MRI scans, at least on conventional MRI, the lesions may look exactly the same. So why exactly are they getting worse? There are various theories. Some people believe there's a low-level smoldering inflammation within the old lesions, invisible to conventional MRIs. This inflammation may not be driven by T and B lymphocytes, the traditional targets of our disease-modifying therapy, but rather different aspects of the immune system, such as the innate immune system, such as macrophages and microglia, and perhaps we need new drug targets to treat this more effectively.
Here's another one I've made a couple of videos about. I think the evidence is pretty compelling. What's difficult is deciding what to do about it. If we get a vaccine developed, that's great, but doesn't it almost seem like we have to give it to people from the moment they're born? Well, that can be problematic. So I'm not sure where this will go, but I'm looking forward to seeing how it unfolds.
EBV, the virus which causes mono or glandular fever, is linked to multiple sclerosis. People who had clinical mono, they have double the risk of MS, and virtually 100% of adults with MS have antibodies in their blood suggesting they've been infected in the past, compared to 95% of the general population without MS. So it's a very common finding. But there's specific evidence that it's likely part of the cause of MS in terms of the timing of infection relative to the onset of MS symptoms. But what do we do about it? Can we even stop Epstein-Barr virus? Over 50% of 5-year-olds have been exposed to the virus, so perhaps we would have to intervene early with a vaccine. There's a product being developed called ATA188 in clinical trials right now in immunotherapy against the virus, but will it work, or is it too late? Has the virus already done its damage and changed the immune system forever? I think we'll get some answers over time. Number 10, and this is super controversial, is the use of disease-modifying therapies in older people with MS. In general with MS, people who are younger are more likely to have clinical attacks, relapses, flares, and new MRI lesions. As people get older, they can be stable or have slowly progressive MS, but they're less likely to have new attacks and new lesions. And because many disease-modifying therapies work on inflammation, some have suggested that they may be less effective in people who are older. And there are some observational studies that suggest this is true. Also, for people who are older, there may be a greater risk of taking certain immunosuppressant medications. So some have suggested there may be a change in the risk-benefit profile as people get older, particularly with newer, stronger medications that have a risk of weakening the immune system. A randomized trial called DISCO-MS, where people over age 55 with MS were actually randomized to continue or stop the medication. They found that 4.7% of people who continued the medication had new disease activity defined as new lesions or relapses, compared to 12% of people who discontinued medication. So that's a pretty significant difference. However, if they looked at disability progression, there was no statistically significant difference, but this was a relatively short study, and there's an extension phase underway.
Well, there you go. That's a lot of information, and I hope that you got something out of it. I'd like to know, do you have other controversies that came to mind as you were watching this, that you were thinking, how come he didn't cover that? Because it is truly controversial. I would have to say I thought of a couple of things. He never really mentioned BTK inhibitors, and that's a really big deal. The mind-body connection, I think, is a very fruitful field to be looking into, and I've made a video about that I'll link to. Also, remyelination. What happened to that? I'm not really hearing a lot of people talk about that anymore. I think some of the initial studies have been disappointing, but it's still the holy grail for multiple sclerosis, and it should get talked about. But I did appreciate what he did have to say about MS medications and nutrition in particular. So I hope you did find this useful. Let me know in the comments what your thoughts are. As always, take really good care of yourself. I'll see you again in my next video.